Hi, I'm Jen Kay, and I'm here today at the Arizona Natural Health Center in Tempe, Arizona. I am so excited and honored to be hosting this segment of natural remedies for common and sometimes not so common conditions. Today's segment focuses on digestive disorders, and we're going to be talking about the ones commonly known as IBS, or irritable bowel syndrome, and IBD, inflammatory bowel disease, and how these disorders can be treated with a natural approach, looking at it from the whole person. It is my delight to introduce to you today Dr. Ham, who treats patients here at the Arizona Center for Natural Health as it pertains to IBS and IBD. Dr. Ham, welcome.
Thank you.
So
it's
glad
a pleasure to be here.
Yeah, we're glad to have you here today. So tell me, we talk about IBS and IBD. What really is irritable bowel syndrome and inflammatory bowel disease?
Well, irritable bowel syndrome is actually a collection of symptoms that people have. About 20% of Americans actually suffer from symptoms that are similar to irritable bowel syndrome. Some of those symptoms might be gas, bloating, diarrhea, constipation, nausea, stomach pain, stomach spasms, things like that. Inflammatory bowel disease is actually an umbrella term for two separate diseases called Crohn's disease and ulcerative colitis. And now the differences are that in irritable bowel syndrome, there's no cause, but inflammatory bowel disease, they show in testing and imaging, we can see inflammation, tissue changes, even ulcers, things like that.
Oh my gosh.
Inflammatory bowel disease also has a lot more stronger symptoms, a lot more severe symptoms, such as weight loss, fevers, bloody diarrhea, things like that. A lot more pain, some joint pain, eye inflammation. Yeah.
More expansive.
More expansive, yes.
So how would someone actually know if they have IBS or IBD versus, let's just say, common gas, you know, oh, my stomach's a little upset, I must have eaten the wrong, how would they know that?
Well, with IBD, it would be much more severe. You wouldn't be having some of those common gas symptoms. Like I said, you'd have some of the bleeding, some of the extreme pain, the weight loss, and then you would go to the doctor, you'd get a colonoscopy, you'd get some imaging and tests done, and you would find out. IBS is a little bit more difficult because I can't find that on imaging or tests. So it's more of a collection of symptoms over and over and over again that some days are better, some days are worse. But it's not like you going somewhere and having a little bit of gas after a restaurant. It's pretty chronic for them.
So, and pretty uncomfortable.
Pretty uncomfortable,
like.
yeah.
That's so fascinating.
Yes, I know. My heart goes out to them.
Without a doubt. You know, sometimes you wonder. So here's then my next question is let's say someone finds out that they maybe have IBS or IBD or going along those lines. What are some of the treatments for IBS and IBD?
Unfortunately, there's really not too many effective treatments for IBS or IBD. For IBS specifically, because there's no identifiable cause, there's no long-term medical treatment that's used effectively for people that suffer from this. So what it is basically is symptomatic management. So if somebody has a lot of diarrhea, they'll get an anti-diarrheal. If they have a lot of constipation, they'll be giving a stimulant laxatives. There are some other things such as anticholinergics and antidepressants even that are given in order to decrease some of the abdominal pain, but it's not always effective, unfortunately. IBD is a little bit more severe because the flares people can have these intense flares with this pain that can lead to hospitalizations or even surgery. So in order to stop these flares, immunosuppressants are given, such as steroids and actual drugs called immunosuppressives. But as you can probably, right,
that doesn't sound good.
As you can probably figure out, if you catch any kind of infection, it's not real good, and you have to have blood tests to make sure that your bone marrow is okay, to make sure your liver is okay. And actually the cure for people that suffer from IBD is removal of that part of the colon.
Oh my gosh.
Unfortunately,
okay.
yeah.
So the conventional approach, as I understand it then, is to treat the symptoms through one of the methodologies you've just described, or remove the organ?
Unfortunately, yes. And if you remove that organ and a pouch is what it's called, is inserted into the intestines, most of the people that have that have to suffer from, it's called pouchitis, where it's chronic infection of that pouch.
So, okay.
Yeah, there's not a lot of
blood-
really good options.
No, and you know, from personal experience, my grandmother suffered from something very similar, and they
I'm so
couldn't
sorry.
identify it for a very long time. And I wish she had known actually about some other ways to approach this, because she
Right.
took a very conventional approach. And I know that here at the Arizona Center for Natural Health, you have a very different approach, right?
We do, yes.
Would you spend a little bit of time telling me about what that approach is and how it differs from the conventional
Sure,
approach?
absolutely. So, you know, people that suffer from this, they have, you know, their life is taken away from them. Things that me and you take for granted.
Without a doubt.
They can't go on vacations, road trips, anything without thinking about where the bathroom is or where they have to stop, things like that. So, you know, my goal with homeopathic treatment is to give these people their life back. And, you know, we do that by taking a homeopathic case and looking at all the individualizing symptoms. So we find one specific medicine that covers all of the symptoms of that person's case. So it takes a little bit of time, and we explore not just the physical symptoms, but we explore the mental, emotional aspects to the case, the mental, emotional aspects of dealing with a disease that's like that. We explore even little individualizing idiosyncrasies to that person to find the most specific remedy to help them. And we help the physical symptoms, we help the emotional symptoms, and we help them have a better quality of life.
And who doesn't want that?
Right.
I mean, you know, there's an approach that's right for everybody. And as I understand it then, so you really spend the time to get to know each patient
Exactly.
individually, discover what the individual contributors to their symptoms may or may not be, and then help identify what remedy would be appropriate for them as a person, not just as a symptom. Is that correct?
Correct.
Do you have, for instance, if we've got a little bit of time, if you've got, would you be willing to share maybe a personal example of a patient who you've taken this approach with?
Yeah. I have a 30-year-old woman. Her name's Janet. Very, very sweet lady, very, very kind. She had been suffering from ulcerative colitis, so the IBD ulcerative colitis, for 10 years. She had come in to see me. She was on 3 medications. She was in the midst of a flare with all the terrible symptoms I already described to you, and she was pretty desperate to get her life back. She couldn't work. She couldn't do much of anything. So we started on just a few little diet changes. We did some probiotics, some fish oils, which produced a little bit of benefit. But once we started the homeopathic remedy, it was the most dramatic change of all. Within 3 months, she stopped bleeding. The abdominal pain was gone. She felt better overall than she said she had in years. She was able to go back to work. And not just that, that was 2 years ago. So since that time, I think she's come back about 3 times with flares that have been just a little bit of abdominal pain, but she never bled again. And
That's
she's one of my
amazing.
most favorite patients. She's such a sweetheart. Yeah.
Oh, that is, we need to get Janet in here.
The best part too is that we did a follow-up colonoscopy, and there was no sign of any of the inflammation or ulcers that she had previously.
So even in the follow-up, regardless, in the follow-up colonoscopy, traditional, you know, conventional
Right.
approach to get that reading,
Correct.
there was no further indication.
Correct.
So anyone who might question, you know, does this really work? It sounds to me like the answer is yes.
It works over and over and over again for me. It's not even a question of if it's going to work. It's just a matter of when.
What an amazing relief that must be to so many people who are struggling,
is.
who've tried everything and the approaches just aren't working, to know that there's actually relief in sight, that there's someone out there that can help them. So let me ask you this. If someone, you know, someone that I loved, you know, if I thought that they maybe were suffering unnecessarily or had symptoms of IBS or IBD, is it just as simple as maybe scheduling an appointment with one of the doctors here?
Yes. Yep. Yes, it is.
Great. Are there any things that you might suggest to people that they could do at home to either prevent it or recognize what's happening for them?
Well, the first thing that you always want to do is make sure that it's not simply an allergy to, you know, lactose.
Okay.
Lactose intolerance can actually mimic the symptoms of IBS. So if you take out lactose and see that all your symptoms go away, then
So
there,
if I eat
then
milk,
there you go.
cheese,
Right,
ice
exactly.
cream, I get a little gassy and get a stomach ache, that
Yeah,
might be
exactly. But
try
some
cutting it out first.
Yeah,
Okay.
exactly. But some people don't realize how intertwined lactose is in their diet until they take it out completely, and they're like, "Oh my God, that's in everything that I eat." So that's one way to just make sure that it's not lactose intolerance. The other thing that people can do is just simply go on a probiotic. They've shown that probiotics are as effective as medications in IBS for symptomatic relief. Some other things is just cleaning up your diet. We don't want to add insult to injury, you know. So
what do you mean by cleaning up your diet? Just tell me a little bit about that.
Unprocessed food, eating organic, not eating your allergens, like wheat and dairy are two huge allergens. Not fatty foods, taking out the alcohol, the caffeine, you know, all the fun stuff.
I like that, yeah. But you know, there's a lot of truth to that. I know a lot of people don't necessarily think about it. It took me a long time to recognize after eating wheat, because, you know, I love fresh made bread and, you know, all of that in sandwiches, that I would experience bloating and maybe some mental fuzziness and some aches and pains. And I didn't associate it for a long time until, you know, until you all educated me. So I'm super grateful. Stress
Management is probably one of the biggest things that people have to realize too, because stress is not only a trigger for flares for IBD, but it triggers the symptoms that people get in IBS. Not many people realize that you have just as many neurotransmitters in your gastrointestinal tract that you do in your brain. So every time you get stressed out,
you have as many neurotransmitters in your stomach as you do in your brain?
Yes.
I have just learned something new. Okay.
So if you're stressing out all the time and you don't have an outlet for that at all, then your whole system is going to be in havoc because of it.
That makes so much sense. Oh my gosh, you have no idea. It's like, okay, when you think about it, I get stressed out and I feel sick to my stomach.
Right, exactly.
Dr. Ham, I could ask you so many more questions about what people can do and about success stories you've had with your patients. And you know, I know how busy you are, and I just want to say thank you so much for taking the time, making the time in your schedule.
It's a pleasure being here.
It's good to have you. I hope you found our segment on natural remedies to common and not so common conditions especially informative today. I know I have. For instance, you have as many neurotransmitters in your stomach as you do in your brain. Makes so much sense. Hey, I strongly suggest you watch our other videos in this series. Please do, so that you can learn how natural remedies can benefit you in your lives starting right now. I'm Jen Kay, and on behalf of myself and the doctors here at the Arizona Natural Health Center, thanks for watching. We'll see you soon.